So it's a very good afternoon. Welcome to Medical Mondays, powered by First Care Solutions. It is joining us today. She's a guest with deep insight with where digital medicine is heading. Dr. Jessica Fuhrman, chief. Wow.
You see why you should have just let me speak?
Yeah, no, I'd rather not.
Because I wouldn't have had these issues.
Are you finished?
Because there's no
Can I start
problem
again?
on my end.
Let's try. Let's try again.
Do it again. From the top.
From the top, Medical Mondays, powered by First Care Solutions, and joining us today is a guest with deep insight into where digital medicine is heading. Dr. Jessica Fuhrman, the Chief Clinical Officer at First Care Solutions. She's one of the brilliant minds shaping how we access quality healthcare virtually and safely.
Good afternoon. Jess the Mess.
Just the mess. I'm getting nicknames left, right, and seat.
Yo, guys.
By the way, Jess the Mess is actually an actual character out there who is on a different breakfast show in the States. So that's why I got it. But you are not Jess the Mess. You are Dr. Jess. Welcome to the Midday Exchange.
Thank you, Kamala. Thank you, Paulie, for such a nice intro.
He gave you the nicest intros that I've ever heard.
I
I didn't even get an intro like that on my first day.
Oh, no?
Like, he just said, there's this girl that I found down the road. She's going to be here for the rest of...
Can I tell you what it is? Jess feeds me. That's what it is.
And she's about to feed our midday.
Yeah, absolutely.
A whole lot of knowledge regarding and insights, obviously, regarding, the future of healthcare that's virtual. Apparently, you're the woman who knows it all, right?
That's the one.
Well, I like to think I've got a lot of experience in it, and I'm very excited to be here. So looking forward to sharing some knowledge.
So first things first, can we explain? I think last week we touched on what exactly it was, but what are the conditions which are perfect when it comes to using this safely?
So great question, and I think that's the one that everyone wants the answer to, is where can I use virtual healthcare? For what can I use it? And I think it's just taking a step back and thinking that most of the diagnosis that a medical professional will make is based on the history that they take. There's obviously value in physical examination and other investigations, but most of what you do is based on that history. So if you can get a really good history, doesn't have to be in person. Could be telephonic or via video consult. So some examples are UTIs, so bladder infections. We get lots of STIs. People are embarrassed to go to their doctor in person, so we talk about it over the phone or via video. Skin rashes, minor allergies, coughs, colds, flus. That's common now with obviously with winter being around. So those are the ones that are really suited well. But that's not to say we can't assess everything. So we could assess everything and give someone advice as to where to go, where we could refer them to.
In terms of what are the red flags in terms of what should prompt a physical visit to the doctor?
So I think anything that's going to need further investigation. So, we're there for the acute primary healthcare concern. That's not the heart attack. It's not the stroke. It's not someone needing IV medication, as in, a drip for fluids or anything like that. That's going to be someone that's going to need a physical consult.
Okay, got you. Okay.
Now, when I was growing up, particularly in varsity, I would always hear my doctor when I would go to him, like, stay off Google. Google is not a doctor.
Google is not your friend.
Because also you type in your symptoms and, like, cancer comes up. And then at that time it's just, flu, or could be pregnant comes up. And poor girl is a virgin. So we know why we don't go to Google today, right?
Yeah, sure.
But that's also just to add to the virtual aspect where I'm going with this question is, how has smart tech, the rise of smart tech, sort of helped or hindered how patients manage? Because I would imagine that because we have this virtual space that's now going on, that patients have become more reliant on that. And like you said, I'm guessing this is what you say when you say, if there's a need, do visit. Like, the virtual part does not take precedence over your physical consultation, right?
Yeah. So that's a lot of points in there that I'm going to answer to. The first one is that Google is important. Everyone has access now to knowledge. Where the medical professionals these days come in is that we help you go through that information. So perfectly fine for you to go and Google your symptoms. My headache has been there for 2 weeks. This is this. What are the symptoms I'm having? But to then come to your healthcare provider, and virtual healthcare is perfect for that, is to come to them and say, look, I read this on Google, I'm worried, I'm concerned, what else should I be doing? So it is a perfect avenue. Exactly. That sort of cohesion between the patient's access to knowledge and my background as a medical professional. So let's work together in coming to something that is reassuring to the patient and gets you the right treatment, because sometimes it is that scary one, that we do need to refer you to the correct person. So just then, that's on the Google part. But going back to your question about smart tech. So when we're talking smart tech, we're talking sort of wearable devices. And this is not a new concept. It's something that people have had, smartwatches, they've had, their Apple devices that can do these things for years now.
Yeah.
Another thing that's been around forever is your own blood pressure cuff at home or your own glucose measurement.
Yes.
That's not new technology. What is new and coming more and more into consultations is integrating that with your healthcare provider.
Yeah.
So sending that information to them. In the old days, you would have, picked up the phone and told the receptionist, and she would have written a note. But nowadays, the platforms are all integrated. So you just once a week load your blood pressure or load your sugar reading or whatever it is. And that's certainly made the available information to us very, very valuable.
Yes.
So what I'm getting is that smart tech hasn't hindered but helped.
Yeah.
Right? Because people can be funny. We could have this help, but then people aren't doing the marrying part. And then now I'm the doctor myself at home.
100%. And that's exactly what I was going to say. So the anxiety around the smart tech, my blood pressure is this. What does that mean? The blood pressure goes up. My blood pressure is up at the moment because I'm speaking to you guys.
You're a natural.
But that's what I'm getting at. Blood pressure changes all the time. Not just because you don't have a perfect 120/80 blood pressure doesn't mean necessarily that there's something wrong.
Yeah.
So smart tech can hinder in that way. And why, I would always encourage someone who's using the technology to marry it with some form of medical advice or assessment.
So for people that are nervous about virtual consultations, how secure and effective are they really? Because I know a lot of people will go, they will search for information. So this is the question that I have is that how safe and secure is it? Because like booking the stuff online, you still have going to Google and going, okay, something's wrong with me, but I don't know what. Like, you get where I'm going with this. So what is, how do we make you feel secure and effective? And are these consultations?
No, absolutely. And I think very important question these days, with the advent of the POPI Act, we've all become very focused on information security. So there's that part, but then there's also the effectiveness, clinically. So if we touch on the digital security of it, all of the platforms, particularly ours, the CareFirst platform, is end-to-end encrypted.
Yes.
So all the information that you're putting in is verified with either an SMS or an email that comes through to your contact details that you've given us. So that's from a digital point of view, that is POPI compliant, encrypted, great, happy. But I'm a clinical doctor, so I'm more interested in how is this going to work and how is this safe for the patient. And all of our doctors that work with us are HPCSA registered, as should be every doctor in the country. But we can prove that for 100% sure. The doctors also have gone through sort of specialized telemedicine or virtual healthcare training, because not every doctor out there is comfortable with this type of this type of consultation.
Yeah.
And also, you need to be very comfortable with the idea that there are things that you can't manage virtually.
Yes.
We're not here to be heroes. We're here to, be a new first step in someone gaining access to healthcare.
There's one thing that I know, Paul, you're super passionate about. But before we talk about that, which is mental health, I think let's take a quick musical break, come back, and then we address virtual care when it comes to mental health.
Welcome to 919.
1.9 FM. Green Grass, George Ezra, right in the middle of Medical Monday, is powered by First Care Solution. a special guest today, the Chief Clinical Officer, Dr. Jessica Voerman. Welcome back.
What a fitting song. Sorry.
Right? Green
Green grass. I don't know about you, but I
put that
associate green with good health or something healthy, nature. And Jess is also wearing green.
I am indeed.
So you know what I say now? I say, you're welcome.
Oh, gosh. Moving on swiftly. Virtual healthcare.
So, quick question for somebody who is, as Kamal mentioned, somebody who's as passionate in following mental health. Can mental health be properly addressed through virtual consultations?
Definitely. I think that is by far one of the most useful areas of virtual healthcare is the mental health space. I think we've come a long way in recognizing that a healthy mind equals a healthy body. And the ability to access care from the comfort of your couch or even your bed on those days where you just don't want to get out. And, you know, speak to someone, I'm anxious, I'm depressed, or whatever it is that you're feeling emotionally, and then have a plan going forward, whether that is just to talk to someone or, you know, to get a referral to psychology, psychiatry, get medication to help you through the week. But we mustn't underestimate just talking to someone, how much that helps.
Oh, yeah, absolutely.
Because I would imagine it does sort of breach the whole therapy session thing, because especially like in your rural areas or, you know, lower income homes where therapy, I won't lie, is seen as some sort of a luxury service. You know, nobody's got time to sit on a shrink's couch.
Sure.
These are things, especially as a person of color, that I know, you know, you grow up hearing, like what is stress, what is depression. Those things don't exist in our homes, you know. But with today's generation, even though that doesn't exist, something like virtual counseling. So I understand absolutely what you mean.
That access is there and definitely works. And I think, you know, our government has gone a long way in recognizing that as well. They've put mental health care at the primary healthcare level.
Yeah.
And they're focusing on a lot of primary healthcare rather than saying, oh, no, it's only in hospital or you've got to be on, you know, these higher plan medical aids in order to access mental health care. And that's certainly where there's a lot of growth going to happen in the virtual healthcare space is within mental health.
Just what, in your opinion, you know, and in your experience, would you say patients tend to misunderstand the most about online healthcare?
I think it goes back to what I said about, you know, we're not heroes. We're not here to treat everything. So you might make a consultation with the doctor expecting them to sort out your problem. But our training is this person appropriate for virtual healthcare? And or do they need something more that I can't provide them in an in-person? So you might go to a virtual consult or have a virtual consultation and the doctor ends up not writing you a script. They, you know, referring you on to a specialist or even to the ED or your GP. And I think there is maybe that misconception that, well, firstly, that this doctor can sort out everything or that this doctor can't do anything. You know, I've had before, you can't be a real doctor. If you know,
you're online.
Absolutely. What do you do for a living? Well, I'm in virtual healthcare, but I'm not a real doctor.
Scam alert.
Exactly. And we're getting more and more where there is that acceptance of virtual healthcare and making it more and more okay for people to do this.
You just said something earlier, and that was about how when you do, in an instance where I'm Gamwe and I come to you, and it so appears that I need more, I need a face-to-face. What then becomes the next step? We are in a consultation, you and me. You realize, oopsie, this needs more. What then happens after that? Is that something that's communicated on the spot? How do you then help me get that more? Because I can imagine I'm here in the first place because I don't have maybe the resources to get to a face-to-face. It was easier for me to buy data for R5.
Sure.
Exactly. A very good question and something that we face daily. I think what's important is that there is that communication with the patient at the time to say, I've done my assessment of you and I feel that you are more appropriate for an in-person visit, what I can do is offer you X, Y, and Z. But if there are 2 steps to it. So give you a script for your antibiotics, your painkillers, that sort of thing. But if you're not better in 3 days, don't come back to me. You need an in-person visit.
Yes.
And then secondly, recognizing on the first visit that someone's not appropriate and going, okay, I'm referring you to Dr. X or a specialist, and we will write that referral letter for you, email it to you as we would your sick note or your script, and you can take that then to your provider of choice.
So you can add sick notes as well.
Correct.
Virtually.
Yeah.
I guess I give you my email and
Exactly. So part of the sign-up process would be your email address. And then we, within sort of 5-10 minutes, maximum half an hour of the consultation,
It's crazy.
we would send through your
I
documents
love
to
that
you.
so much.
And-
Not the sick note part.
I'm planning for the week.
Yeah, next week. How do you see this process evolving over the next 3 to 5 years?
So I think we touched on it nicely in the beginning as well. And I think it is that cohesion between the in-person consults and the virtual consults. And using the virtual consult as an entry point into the healthcare system and moving on from there if needed.
Okay.
It'll mean that people seek care sooner. So we get you potentially are lessening the amount of serious illness out there.
Yes.
If we can catch someone early in their disease process, treat them early, and then refer early. So that's where I see it is this sort of hybrid of virtual and in-person care.
healthcare. Yeah.
I'm sorry. I'm now sitting here and I'm thinking to myself, I wonder what's the most serious thing you've had to, do I say diagnose virtually?
Or help with.
Or
I am here to help.
Because you think virtually because you don't take it as seriously as a face-to-face, you're probably like, I'll just go there for bad period pains or flu.
Yeah.
But I'd never go if I was going through chemo, for instance. And that's why I'm asking the questions. So people know just how vast
Where
and
is the
wide
line,
the
yeah.
scope.
So there is no line. And I think that's a very important point. If you need help, do it virtually if you can't do anything else. So we've had, I've got plenty of stories over the years, but I mean, one that stands out is we had a woman use the platform, called in to say, my helper at home has collapsed. What must I do? And first thing is, okay, you need to call an ambulance. We're going to stay on with you, but you need to call an ambulance. So she literally on the video with us, the helper's there. We turned on her side. She was still breathing. We didn't need to direct CPR or anything, but and called the ambulance while we're on with her. Okay, what must I do now? Well, okay, is she still breathing? Just you take a deep breath. Everything's calm. That help. Someone's not thinking in a moment of emergency.
Yeah.
Okay, and virtual healthcare, yes, we're there to diagnose and treat illnesses, but we're also there to assist. And in times of need that maybe you just need someone objective outside of the emergency to help you. Because all of us sitting here know, okay, we're going to call emergency services. We know the number off by heart.
I'm going to freeze. I'm calling
in an emergency, right?
I'm going to freeze.
Absolutely. So
That's my response.
sure.
I think for me, one of the most important things is, and I speak for I try to speak for a sort of a percentage of saying that in a moment of crisis like that, you tend to feel more supported or you feel better because you're not online alone. There is somebody with actual knowledge who's guiding you through the process. And I think that's what gains trust, right?
Absolutely. Absolutely. And it could be as serious as we're directing you how to do CPR. I've never had one of those cases on our platform, but you could do that. We could talk you through it. In just on a side topic, because I talk a lot, but training these days, a lot of it's going AI and virtual. And there's a lot of evidence in training literature for training doctors and medical professionals that to be a team leader, you must step out of the situation, and so that you can see the broad perspective, the broader picture, rather than just focusing on one task at a time. So if you apply that same principle to what we're doing, we're outside of that emergency situation, and we're outside of your medical problem. So
Like an eagle eye.
Absolutely. And you know, the eagle eye sees more than that focused. So
And then for, our listeners who are listening now and are just like, oh my gosh, I need to jump onto this, how do they do that? How do they sign up? Where do they go?
So it's as simple as going on carefirst.co.za. You'll see my face there. And it'll guide you through the process. It basically will take you through a registration online, verification process to make sure that you're the person.
Is it free? Is the sign up free?
Sign up is free.
Okay.
Sign up is completely free, and then you can go through all the different available services on there, because there's more to just the virtual consult. And then you can do a skin scan if you want to. You can do
that's
just your vital scans. There's lots on there. So carefirst.co.za, and it'll take you through.
Final advice for our listeners unsure of whether to book online or in person. Like, how do you determine which is the best way forward?
Oh, absolutely. And I think, there are still hesitancies in using virtual healthcare. I think, can I use this if I don't know how to use a cell phone or that sort of thing? And I think just to reassure people that it's a very simple process.
Yes.
And the doctors are here to help. So if you're struggling, there will be some contact made with you to say, are you struggling? Can we help you? Can we just convert it to a telephonic?
So a bot can pick up that.
So we've got support structures to do that. Yeah. So we've got support structures so that if you do get stuck on some part of the virtual process, we can contact you and say, look, we see you've been trying to book a consult.
Yeah.
Can we, make an alternative arrangement? Can we just do a telephone call? Because clearly you've gone on there wanting help.
Yes.
And we're here to do that. So whatever it is. And some people say, no, I was just testing and I made a mistake, pressed the wrong button. But, there are people who were struggling. So I think that's maybe just the reassurance that we're here to help.
Sure.
It is an easy process, but don't be intimidated by it. And it's for everyone. It's not just for the person who's comfortable with the smartphone. You could do it, with anyone, for anyone.
Okay.
Kids,
Gotcha.
elderly people. So
Thank you so
benefit
much.
is-
Yeah.
I keep learning more and more, and it's becoming more convincing that I should. I don't know if you listened last week.
I did.
I don't trust doctors. Now, a virtual doctor. So I'm going to say it again. I still need to do that virtual consultation so that I can come back and report to our crew.
I'm a follow-up.
that, hey, this works.
Definitely.
It took me 5 minutes. This was my hiccups, or I didn't have any hiccups. I think it's. Am I going to do it with you?
You will do it with whoever is available, and at any given time, there's
No,
three of us.
I wanted to
So
be you, James.
we can schedule a call.
Yeah, you see now.
I want friendship privilege.
Yeah.
Well, I'll make a plan for you. Come on, I'll make a plan for you. But I can reassure you, my doctors, all of them are just as good as me. So, if not better. So,
Who's better than number one?
Yeah, he's better.
no.
Why try
Everybody
harder?
that's been here so far has told
not
us,
so
oh,
hard.
you are meeting the head girl. Like, you think we're cool? Wait until you meet Jess.
Yeah.
The face and the hearts are they putting.
People are so nice.
Dr. Jess, thank you so much for your time.
Thank you for having me.
If you have questions, people want to pop along to the website. What is that website address again?
Carefirst.co.za.
Powered by First Care Solutions. We'll do it all again next week.
Next
So-
week.
Next week.
I wonder what's the topic.
Yeah, I'll show you.
Are you going to share it?
I'll show you. Dr. Jessica Fuhrman, thank you so much for your time and your insight. We all feel much better because we know that healthcare is literally a click away.
Thank you so much.
Thank you.